You crush a workout. You feel amazing. You go to bed genuinely proud of yourself. And then, 2 entire days later, you cannot sit down on a toilet without making a noise you have never made before. So what took it so long? This delay has a name. Delayed onset muscle soreness, or DOMS. It usually shows up around 24 hours after the workout, and it peaks somewhere between 1 and 3 days later. But before we get to what causes it, we have to kill the explanation that almost everyone believes. Lactic acid. Lactic acid is real, and it does something real. When you push hard, your muscles produce it, and it is part of that hot, burning, shaky feeling you get during the last few reps. But here is the problem with blaming it. Lactic acid is cleared out of your muscles within roughly an hour of finishing. It is completely gone long before the soreness even starts. So it cannot possibly be the thing hurting you 2 days later. It has an alibi. Let it go. What actually happened is much smaller and much weirder. You caused microscopic damage inside the muscle itself. Zoom into a muscle and you find long fibers, and inside those, tiny repeating units that slide together to shorten. That sliding is, essentially, every movement you have ever made. Push those units harder than they are used to, and some of them get pulled apart. Not a tear you could ever see. Just tiny, scattered structural damage at the microscopic level. And one specific kind of movement causes way more of it than any other. It is not the lifting part. It is the lowering part. Scientists call it an eccentric contraction. Your muscle is producing force while it is being stretched, lowering a dumbbell slowly, the downward half of a squat, walking downhill. In those movements, fewer fibers end up carrying more load while being pulled longer. That combination is brutally good at causing microscopic damage. Which is why walking down a mountain destroys you far more than walking up it did, even though going up felt so much harder at the time. But hold on. If the damage happens during the workout, why does nothing hurt during the workout? Because the pain is not coming from the damage. The pain is coming from the cleanup. Your immune system notices the microscopic mess and sends in a repair crew. And a repair crew does not arrive instantly. It has to be called, assembled, and dispatched. Over the next many hours, inflammation builds. Fluid moves in, the area swells slightly, and immune cells flood the tissue to clear out debris and start rebuilding. And those repair chemicals do something sneaky. They sensitize the nerve endings sitting in and around the muscle. They turn your pain dial up. So now a completely ordinary stretch, or even just pressing on the muscle, gets reported to your brain as pain. The muscle is not more broken. It is more sensitive. And that entire cascade takes a day or 2 to fully ramp up. That is your delay. Your soreness is not the injury. It is the renovation crew being extremely loud. Quick honest footnote. The fine details here are still argued over. Some research points at connective tissue rather than the muscle fibers themselves. The timing and the inflammation part, though, are solid. Now the genuinely great news, and it is called the repeated bout effect. Do that exact same workout again a week later, and you will be dramatically less sore. Sometimes barely sore at all. Your muscles adapt after a single exposure. That protection lasts for weeks. Which is exactly why your first day back at the gym after a long break is always the worst one. And one more myth worth deleting. Soreness is not a scoreboard. It mostly measures how unfamiliar a movement was, not how effective it was. A really common question, should you train while you are still sore? For ordinary soreness, generally yes. Gentle movement actually tends to help because it drives blood flow into the area. Just do not load a badly sore muscle heavily. And never confuse soreness with an actual injury. You can absolutely build strength without ever getting sore, and being wrecked does not mean the session worked. If you only chase soreness, you will just keep choosing new movements instead of getting better at any of them. What about ice baths and foam rolling? The evidence here is genuinely mixed. Massage and foam rolling do seem to modestly reduce how sore you feel. Ice baths might dull the pain. But there is real research suggesting that routinely icing after training can blunt some of the very adaptations you were trying to earn. As for what helps, gentle movement and blood flow, sleep, eating enough protein, and patience. Stretching beforehand, despite what everyone says, does not really prevent it. One important exception, and this one matters. If the soreness is extreme, if a limb swells up dramatically, or if your urine turns dark like cola, that is not normal soreness. That can be a rare condition called rhabdomyolysis, and it is a genuine medical emergency. Go get seen. And this is not just a gym thing. Helping a friend move furniture, your first day skiing, A long hike back down a mountain, or one overly enthusiastic afternoon of gardening will do it just as easily. Your muscles do not care what the activity was called, only that it was unfamiliar. So the next time you cannot walk downstairs like a functional adult, remember, your muscles are not damaged goods. They are a construction site. If this explained your last leg day, smash that like button, subscribe to Curious Doodle, and go move around a little. Gently.